Hello, my name is Frederick, and I am here to conduct a head-to-toe assessment. My tools here today are my sanitizer, my pen light, my cotton ball, my gloves, and my stethoscope. I'll be walking into the room, closing the door to ensure the safety of my patient, safety and privacy of my patient. I'm gonna walk in, wash my hands. Okay. Can you tell me your name and your birthday, please?
Beatrice Arguez, March 12, 1950.
Okay, today we'll be conducting a head-to-toe assessment. Is it okay if I'm able to touch?
Yes, no problem.
Okay. General survey starts now. Okay, patient appears, her age, gender, skin tone, matches genetic background. She walked in with gait, both her arms and legs are swaying. The patient shows no signs of distress. Facial expression, mood is normal. The body contour and symmetry is normal. I'm going to ask you a few questions. Okay, do you know where you are?
At home,
Do you know the date?
February 3, 2021.
Okay. Do you know who the president is?
Joe Biden.
Okay. The patient is alert and oriented and was able to follow instructions. So I'll go ahead and inspect the head. I'm looking at the hair. The hair distribution seems to be normal. I'm gonna check the hair. Do you feel any tenderness?
No,
Okay, there's no tenderness. There's no signs of masses. There's no infestations. She has white hair, but that's normal for her age. I'll be making a note of that later. I'm looking at symmetry of the face. Looks to be normal. There's no signs of swelling. It's a normal cephalic. Now I'm looking at the, I'm gonna palpate the temporal mandibular joint. Okay, do you feel any tenderness there?
no,
Okay, can you open your mouth and close it? Okay, temporal mandibular joint is normal and full range of full motion. I'm gonna palpate and percuss the sinuses. Okay, do you feel any tenderness there?
no,
Okay, do you feel any tenderness there?
no,
Okay, now I'm gonna palpate. Okay, palpation shows normal sounds and no tenderness on the sinus. Okay, now I'm gonna check the eye. I'm inspecting the eye. The eye seems symmetrical. There's no signs of discharge or lesions. The eyebrows and the eyelashes shows no infestations. The eyeball and iris is nice and moist and no lesions. I'm gonna check your eyelids, under your eyelids. Okay, the conjunctiva is nice and pink. The sclera is white, as it should be. Now I'll be checking for pupil reflexes. Okay, I'm gonna dim the lights. I'm gonna have you stare at that object on the other side of the room. Okay, both pupils are round and equal and reactive to light at 3 millimeters. Okay, now I'm gonna have you check for accommodation. I'm gonna follow you this pen. Okay, both eyeballs converge into axis and both constricted, both reacted to accommodation. Now I'm gonna check the ears. I'm looking at the ears. The ears are symmetrical. There's no swelling or obvious abnormalities. I'm gonna palpate your ears. Okay, do you feel any tenderness?
no,
Patient has no tenderness. There's no masses. There's no thickness. Now I'll be checking for the external meatus and the membrane. Okay, external meatus is nice and pink. The membrane is translucent. Okay, now I'm gonna check the nose. Okay, I'm looking at the nose. The nose is midline and symmetrical. There's no signs of a deviated septum. I'm gonna palpate the nose. Do you feel any tenderness?
no,
Okay, no tenderness or masses on the nose. Now I'm gonna check the inside of your nose. Okay, there's no signs of discharging or bleeding or obstruction. Okay, I'm gonna oculate each nose, each nurse, and breathe. Okay, both nerves are clear. Now I'm gonna check your mouth and your throat. Starting with your lips. You're looking at the lips are nice and moist. There's no signs of cracks or dryness. Can you open your mouth, please? Okay, I'm checking the mouth. Oral mucosa is pink and moist. The posterior anterior palate is nice and pink. The patient has dentures, but the patient has dentures, but that's normal to her age. Okay, I'm gonna check under your tongue. Okay, there's no ulceration or masses. Okay. Now I'm gonna take the tongue depressor, imaginary tongue depressor. Okay, you're gonna say ah. Say ah. Stick your tongue out. Stick your tongue out. Okay, tonsils look to be normal at 2+. The uvula is normal. Okay. Now I will be checking the neck. Okay, the neck is midline and symmetrical. There's no discoloration. There's no abnormalities. There's no signs of distension. I'm gonna palpate your neck. Okay, do you feel any tenderness?
No.
No tenderness. Okay. Now I'm gonna feel your carotid. Your carotid. Are you going to take your penetrator? I'm palpating the carotid one at a time. Okay. There's no sign of distension. Now I will check the thyroid or your lymph nodes. Lymph nodes. I'm gonna start with the postocular, preocular, submandibular, submandible, and then the post and posterior anterior clavicle lymph nodes. There's no signs of lymphedema. Okay, now I'm gonna check your posterior thorax. Can you turn around for me, please? Okay, I'm looking at the AP and the transverse ratio is 2:1, which is normal. There's no signs of barrel chest. I'm looking at the scapula. Scapula seems to be aligned. Okay, there's no signs of kyphosis, scoliosis, or lordosis. Okay, now I'm gonna check for chest expansion. Okay, can you breathe for me? Okay, chest expansion is normal. Now I'm gonna check for tactile firmitas. Okay, can you say 99?
99.
Say 99?
99.
Say 99.
99.
Okay. Tactile firmitas showed equal vibrations in both lungs. Now I will check for is there any tenderness?
No.
No tenderness, no signs of masses. I'm checking the back I'm checking the temperature with the back of my hand. Temperature is warm. I'm gonna go and auscultate. Okay, I'm gonna start with the left apex with the diaphragm of my stethoscope. Okay, breathe. Okay, right upper diaphragm, right upper apex, the right upper lobe, the right lower lobe, the left middle lobe, right middle lobe, the right mid axillary, the left mid axillary. Okay, lungs are clear. There's no adventitious sounds. Okay, go ahead and have a seat again. Okay, now I'm gonna inspect the anterior thorax. The anterior thorax seems to be symmetrical. There's no signs of discoloration. Looking at the breathing, her breathing does not she's not using accessory muscles to breathe. Okay, I'm gonna palpate the chest. Okay, do you feel any tenderness there?
No.
No tenderness? Okay, no signs of masses. Checking the temperature. Temperature is normal. Okay, now I'm gonna auscultate. Starting with the right upper apex, the left upper apex, left upper lobe on the second intercostal space, the right upper lobe, the left mid lobe, the right mid lobe, the left mid lobe, and then the mid axillary, and then the right mid axillary. Okay, there's no adventitious sound. Lung seems to be clear. Now I will check for the upper extremity. I'm looking at both upper extremity. Seems to be normal. There's no signs of abnormalities or weakness. The hair distribution is normal. The color seems to match with the rest of the body. Okay, now I'm gonna have you do a test range of motion for me. You're gonna go flexor, extender, pronation, supination. Okay, range of motion is normal. Okay, we're gonna check for strength. You're gonna go like this. Then you're gonna push forward. Okay, you're gonna push backwards. Okay, muscle strength on the upper extremities at 5 for 5. Okay, now I'm gonna check for capillary refill. Okay, I'm gonna press down. Okay, capillary refill is under 2 seconds. I'm gonna check the radial pulse. Okay, radial pulse is normal. So now I will lower the head of bed at 45 degrees. Okay, you need to lay back. Okay, first thing I need to check is the jugular veins. Jugular veins seems to be normal. There's no signs of distension. Okay, now I'm gonna auscultate the heart. Starting with the right intercostal space, second intercostal space for the aortic valve, left second intercostal space for the pulmonary valve, third intercostal space for the Erb's point, fourth intercostal space for the tricuspid valve, fifth middle intercostal space for the mitral valve. Heart is normal, there's no signs of a murmur. Okay, now I'm gonna check for apical pulse. Can you lift your left breast for me? No, just your breast, That's fine. The apical pulse is normal. So now I'm gonna lower the bed at completely at 180. Now I'm gonna check for the abdomen. Okay, I'm looking at the abdomen, I'm looking at symmetry, I'm looking at the color. Seems to be normal, there's no signs of distension. What I'm gonna do first is auscultate for bowel sounds, starting with the right lower quadrant, the right upper quadrant, the left upper quadrant, left lower quadrant. Okay, patient bowel sounds are present. Okay, now I'm gonna do a light palpation. Go ahead and keep your shirt up for me, please. Okay, light palpation. Is there any tenderness? No tenderness? Okay. Okay, there's no signs of rigidity or guarding or no signs of masses. Seems to be normal. Okay, now I'm looking at the lower extremity. Both extremities seems to be symmetrical. Hair distribution is normal. There's no signs of discoloration. Now I'm going to show you the range of the foot. Okay, the range of the foot is, you're going to go dorsiflex, plantar flex, dorsiflex, plantar flex. Okay, now we're going to go change the motion. Okay, check the strength. Okay, push forward, push backwards. Okay, muscle strength at 5 out of 5. Okay, I'm gonna go ahead and check the pulse for the dorsalis pedis. Okay, dorsalis pedis seems to be normal. Till the tibialis pulse is also normal. Okay, now I'm gonna check for the neurological. I will check for your fifth cranial nerve. So when I touch with it, you're gonna close your eyes, you're gonna touch a cotton ball and tell me where the location is. Okay, close your eyes.
Forehead. And feet. And
Okay. Patient's sensory seems to be present. Now I'm gonna do the Romberg test. Okay, now go and stand up for me. You're gonna keep your feet together and then your hands on the side.
only stepping down.
No, you don't need to stand up. Prepare. Okay, close your eyes. Okay, 30 seconds. Okay, you can go open your eyes. Okay, go and have a seat. Okay, Romberg shows negative. There's no signs of swaying. That concludes today's head to toe assessment. Thank you.